Hello there. The technocratic Prime Minister Rishi Sunak has led Britain out of the acute crisis, but now he's facing political headwinds. Rishi Sunak presents himself as a crisis manager who wants to solve the big problems in economic migration and health policy. But the new Prime Minister's authority is limited, and in Westminster's Shark Tank, Boris Johnson is already eyeing a comeback, as we hear. But British Prime Minister Rishi Sunak has come under renewed criticism. Parliamentarians and environmentalists are vehemently opposed to flying a Royal Air Force plane from London to Leeds. He flew to a public health centre in Leeds at a time when the country was mired in hyperinflation. And the opposition Labour Party said about this, while patients and staff suffer from a lack of medical facilities, the Prime Minister used a jet to fly from London to Leeds. It has been criticised as wasteful spending at a time when the cost of living has skyrocketed. They called for disclosure of how much the Prime Minister spent on a 3-hour journey for this 36-minute journey. Many MPs and environmentalists were outraged that he not only wasted taxpayers' money, but also ridiculed his promise to protect the environment. The Prime Minister's office has since responded to this criticism. They claim they chose this route to take advantage of the time in this busy schedule. They said they chose air over rail because of the pressure and schedule. So far, this type of criticism has come. Their summary says Sunak spent tens of thousands of pounds of personal money travelling from London's Battersea to Wales to attend a dinner hosted by Tory leaders. And healthcare in Britain is in crisis as well. And that's why people are complaining. On average, emergency patients had to wait an hour and a half for an ambulance in December. And the average wait time for an ambulance and emergency room treatment is extremely long in the UK. On average, it took around an hour and a half, as I said, for an ambulance to arrive in an emergency in December, and that is according to the NHS Health Service. Emergencies include severe burns, epilepsy and strokes. In less urgent cases, such as minor burns, the waiting time was around 4 hours and 20 minutes. Patience is also required in the emergency room. According to the NHS, more than half of the patients have had to wait at least 4 hours. The NHS has been underfunded, understaffed and overwhelmed since the pandemic for years. The Conservative government and the unions are locked in a collective bargaining dispute. Health Secretary Steve Barclay refuses to increase wages by more than 4.5%. Workers are demanding an increase in line with inflation, which has recently exceeded 10%. The nursing staff went on strike this time for the first time, and rescuers stopped work again on Wednesday. And new strikes are planned for quite a long time now. And the waiting list for surgeries got slightly shorter for the first time since May 2020. According to the NHS, 7.19 million people were waiting for a surgery in December. In the previous month, it was 7.21 million. And Prime Minister Rishi Sunak has promised to quickly clear the backlog created primarily by the pandemic. But the understaffing was not caused by the pandemic that had an earlier issue. It was the underfunding and the austerity of the last 12 years. It was the staffing problem because of Brexit, because continental Europeans are not that fond of going there anymore with all the visa trouble. And since the Brexit campaign, you must say, I know a lot of people who are not fond of working in the UK anymore because of the resentment against foreigners. If you read the comments on my videos, once they are back, it takes maybe another 24 to 48 hours until they work stable again on this channel, because restoring a channel is not that easy. It's a lot of technical stuff involved. You can see that there's a lot of foreigner resentment there, and you can hear it. Just listen to the politicians. All in front of them are Priti Patel, Suella Braverman, and so on. So the NHS will need much more than this government is willing to do. And I'll see you in my next video. I'll be back.